Welcome to our educational video on ischemic heart disease, or IHD, a condition affecting millions worldwide. If you've ever wondered what lies at the heart of this common cardiac condition, you're in the right place. Ischemic heart disease is primarily characterized by reduced blood supply to the heart muscle, a situation that arises due to atherosclerosis of the coronary arteries. This essentially means that the vessels supplying life-giving blood to your heart are narrowed, restricting the flow and potentially leading to dangerous complications. From the gripping chest pain known as angina that may radiate to your left arm, neck, jaw, or back, to atypical symptoms like dyspnea, fatigue, or nausea, the manifestations of IHD can be diverse and often unsettling. But don't worry, it's not all doom and gloom. In the next 10 minutes, we'll cover the essentials of IHD, including its causes, symptoms, diagnosis, treatment, and prevention. IHD occurs due to reduced blood supply to the heart muscle, primarily caused by atherosclerosis of the coronary arteries. This statement is the key to understanding the root cause of ischemic heart disease. But what's atherosclerosis? And what are coronary arteries? Atherosclerosis is a condition where plaque, a mixture of fat, cholesterol, calcium, and other substances, builds up in the walls of the arteries. Think of it as rust clogging up a pipe, but in this case, the pipe is your artery and the rust is the plaque. Over time, this plaque hardens and narrows the arteries, making it harder for blood to flow through. Now, let's talk about coronary arteries. These are the major blood vessels that supply your heart with blood, oxygen, and nutrients. They are crucial for the heart's function and survival. When atherosclerosis happens in these arteries, it's known as coronary artery disease, the most common type of heart disease. So, when the coronary arteries are narrowed by atherosclerosis, the heart doesn't get enough blood, especially during physical activity. The heart muscle has to work harder with less oxygen, leading to chest pain or angina, a classic symptom of ischemic heart disease. But it doesn't stop there. If the plaque in the artery ruptures, it can cause a blood clot to form. This clot can block the blood flow completely, leading to a heart attack. That's why atherosclerosis is such a major concern and the main cause of ischemic heart disease. However, atherosclerosis isn't the only cause. Other factors such as spasms or diseases of the coronary arteries can also lead to ischemic heart disease. It's a complex condition with multiple contributing factors. In a nutshell, ischemic heart disease is a consequence of impaired blood flow to the heart. Whether it's from atherosclerosis, spasms, or other diseases, the result is the same. The heart muscle doesn't get the oxygen-rich blood it needs to function properly. This narrowing of the vessels restricts blood flow, leading to myocardial ischemia and potential complications. Symptoms of IHD include chest pain or discomfort, also known as angina, which may radiate to the left arm, neck, jaw, or back. Let's delve into this a bit more. Angina is often described as a pressure, heaviness, tightness, or squeezing sensation in the chest. It's usually triggered by physical exertion or emotional stress, and relieved by rest or nitroglycerin, a medication that widens blood vessels to increase blood flow to the heart. Angina is the heart's way of saying, "I'm not getting enough oxygen," and it's a red flag that coronary arteries might be blocked or narrowed. But here's the tricky part. Not everyone with ischemic heart disease experiences chest pain. This is especially true for women and the elderly, who are more likely to have silent ischemia or ischemia without pain. They may instead have atypical symptoms, which can make IHD more challenging to recognize and diagnose in these populations. These atypical symptoms can include shortness of breath or dyspnea, which may occur with exertion or at rest. Some people describe it as feeling like they've just sprinted 100 meters, even though they've only walked a few steps. Fatigue is another common atypical symptom. This isn't just everyday tiredness. It's a profound, persistent exhaustion that doesn't improve with rest. It can affect physical stamina, but also cognitive function, leading to difficulties with concentration and memory. Nausea and epigastric discomfort, or discomfort in the upper central region of the abdomen, can also occur. This can be mistaken for indigestion or other gastrointestinal issues. In fact, Some people with IHD initially seek treatment for what they think is a stomach problem, only to find out later that the heart is the root cause. However, atypical symptoms such as dyspnea, fatigue, nausea, or epigastric discomfort can also occur, especially in women and the elderly. Understanding these symptoms is crucial to early detection of IHD, which can lead to more effective treatment and better outcomes. Diagnosis of IHD involves a thorough history-taking, physical examination, and various diagnostic tests. The journey to diagnosing ischemic heart disease usually starts with a detailed patient history. Doctors want to know about any symptoms you've been experiencing, your lifestyle, and your family history of heart disease. All these factors can shed light on your risk level and help guide further testing. Next comes the physical examination. This might seem routine, but it's an essential step. Your doctor will check your blood pressure, pulse, and listen to your heart and lungs. They're looking for any signs of heart disease, such as a heart murmur or fluid in your lungs. But the real key to diagnosing IHD lies in the diagnostic tests. The first of these is often an electrocardiogram or ECG. This test records the electrical activity of your heart. It can show if your heart is under strain or if you've had a heart attack, both potential indicators of IHD. Echocardiography is another valuable tool. This ultrasound of your heart visualizes its structure and function. It can reveal areas of the heart muscle that aren't contracting normally due to poor blood flow, or even a previous heart attack. Stress testing takes these examinations a step further. It involves monitoring your heart while you exercise, usually on a treadmill or stationary bike. If exercise triggers symptoms, it can be a clear sign of reduced blood flow to your heart muscle. Coronary angiography is the most direct method to visualize the coronary arteries. It uses a dye and special X-rays to show the insides of your coronary arteries, highlighting any blockages. Finally, doctors may check your blood for cardiac biomarkers, such as troponin levels. Troponin is a protein that's released into the bloodstream when heart muscle is damaged. Elevated levels can indicate a heart attack. These tests help confirm the diagnosis and assess the severity of the disease. Each brings a unique piece to the puzzle, helping healthcare professionals to form a comprehensive picture of your heart health. With a confirmed diagnosis, the most effective treatment plan can be put into action. Treatment of IHD focuses on lifestyle modifications and pharmacotherapy. Indeed, managing ischemic heart disease often starts with embracing healthier habits. Smoking cessation is a crucial first step, followed by adopting a heart-healthy diet that's low in saturated fats, cholesterol, and sodium. Regular exercise and weight management are also fundamental, as is finding effective ways to reduce stress. Pharmacotherapy plays a significant role in controlling IHD. Antiplatelet medications help prevent blood clots, while statins work to lower cholesterol. Beta blockers and ACE inhibitors can help manage blood pressure, and nitroglycerin is commonly used for symptom relief. In severe cases, when medication and lifestyle changes aren't enough, revascularization procedures might be necessary. Percutaneous coronary intervention, or PCI, is a non-surgical procedure that uses a catheter to place a small structure called a stent to open up blood vessels in the heart that have been narrowed by plaque buildup. Coronary artery bypass grafting, or KBG, is a type of surgery that improves blood flow to the heart. Here, a healthy artery or vein from the body is connected, or grafted, to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, creating a new path for blood flow to the heart muscle. But as the old saying goes, prevention is better than cure. This is particularly true for IHD, where managing risk factors can significantly reduce the likelihood of developing the disease. Regular screening for conditions like hypertension, diabetes, and high cholesterol can help detect these risk factors early. Patient education is another crucial aspect of prevention. Understanding the disease, its causes, and its potential complications empowers individuals to make informed decisions about their health. In conclusion, the treatment and prevention of ischemic heart disease involve a comprehensive approach that combines lifestyle changes, medication, potential surgical intervention, and a strong emphasis on patient education and early detection. Prevention is key in managing IHD, emphasizing early identification and management of risk factors, regular screening, and patient education. In conclusion, ischemic heart disease is a significant health concern. Over the course of our discussion, we've explored the complex factors that contribute to this condition, from the narrowing of the coronary arteries to the diverse symptoms that can manifest, including the often overlooked atypical symptoms in women and the elderly. We've also delved into the diagnostic process, emphasizing the importance of thorough history taking, physical examination, and a range of diagnostic tests. Treatment, we've noted, is multifaceted, combining lifestyle changes with a range of medications, and in severe cases, revascularization procedures. Crucially, we've underscored the significance of prevention in managing ischemic heart disease. This involves early identification of risk factors, regular screening, and patient education. These strategies are crucial to minimizing the impact of this prevalent condition. But with proper understanding, early detection, and comprehensive management, its impact can be minimized. Thank you for watching our video on understanding ischemic heart disease.